All right, Mike, thanks much. This year, an estimated 150,000 people will be diagnosed with colorectal cancer, joining more than 1 million patients. And that's why the Colorectal Cancer Alliance and others are calling today Dress in Blue Day. MedStar Health Gastroenterologist Dr. Niki Asamoah joins us now to talk about some signs and prevention. Good to see you. Good morning.
Good morning. Thanks for having me.
So we wouldn't be talking about this without trying to get an idea of what we're talking about. And for so many people, they might, look, let's be honest, a lot of folks don't come see people like you as much as they should. So are there any signs that we should be looking out for first?
Yeah, the signs of colorectal cancer include changes in your bowel habits, rectal bleeding, anemia, and even weight loss. But the important reason why we're here today and this month is to point out the importance of prevention, screening. So colorectal screening, cancer screening is a huge part of what we do and the reason why we're here this month. Colorectal cancer, as you know, is the third most common cause of cancer in both men and women. So if we can prevent this with our screening tests, then that's exactly what we want to do.
We just, for whatever reason, a lot of people just don't want to go through the process. They don't want to do the screenings. Yeah. It's hard enough for people to go get their colonoscopies when they turn 50 years old or younger. We just have this mindset. How important is it to actually do this? And who really should be doing the screenings?
Yeah, so anyone over the age of 45 and older, the new recommendations, because what we've seen is that younger people are being diagnosed with colorectal cancer. Over the last 10 to 15 years, the rates in older people are actually going down because they're getting more prevention, whereas the rates in the age of 45 to 50 is going up. So age 45 is when we start doing colorectal cancer screening. There are lots of tests. So most people want to avoid colonoscopies because they're not fun and you have to drink a terrible bowel prep. It's a great exam. It's the gold standard. It's the way that we prevent colorectal cancer. However, there are other options. There are stool tests that people can use. Flexible sigmoidoscopy is an alternative, and even virtual colonoscopy, which is a CT scan that looks for lesions in the colon. The best screening test is any screening test that can be done. And the important part about these screening tests is that you can pick up things, precancerous lesions or polyps early to remove them. And even cancers, you detect them a little bit earlier to prevent, progressive disease later.
Sure, it makes a big difference. A lot of attention came to this when Chadwick Boseman passed away, and a lot of folks obviously didn't realize what he was dealing with until after we found out that he had passed. Did that help in any way? If you have somebody with a big name like that, does it draw more attention? Do you think it made a difference?
It's unfortunate, but it did. When I see my patients, you think I'm 45, I don't have this, I won't be at risk, but we really don't know our risk until we do our screening tests. And so I encourage my younger patients, check your family history. That's a risk factor. And dietary things are risk factors, but having someone like Chadwick Boseman definitely brings light to the condition, and it gives us the opportunity to use that as an example of this is why we should be screening a little bit earlier.
Hopefully a couple people will decide that they want to get screened after hearing this today. Dr. Niki Asamoah, thanks for joining us this morning. Appreciate it.
Thank you so much for having me.
There's some information for MedStar. If you want to get in touch with them there, you can follow the links you see on your screen.